Well, thank you everyone for joining us today. We had this masterclass scheduled for Monday, and unfortunately, Dr. Holden was out sick, so we rescheduled it for today. So thank you for taking time out of your Friday to join us. We're excited to have you, Dr. Holden.
Thank you. I'm excited to be here. So I hope to add lots of value to everyone's med spas today, med spas, wellness centers, plastic surgery centers, whatever type of location you are running as a business manager. I'd love for you guys to actually put in what your role is. If you're an owner, a manager, an injector, an MA, whatever your role is, if you type it in over there, I'd love to see it as I'm talking, because this is so important. And also, if you're involved in training, and I'm guessing you're on this because you are involved in training, and I see there are a lot of owner, injector, director, perfect, director of marketing, manager, beautiful, med spa manager, amazing. So today we are going to be talking about staff training and the blueprint for thriving teams. And just to give you a little background about my team, if you've never heard me speak before, I'm in San Diego. So San Diego, my practice name is Holden Timeless Beauty, and I'm powered by Alpha Aesthetics. So I'm a co-founder of Alpha Aesthetics, if you've ever heard of that. And my particular med spa, we have 4 locations. We have 13 injectors, and we have a structure that suits us for our teams. And I'm going to go through what I've developed through the years. I was an educator prior to coming into aesthetics. I ran the residency programs for UCSD in the emergency department, and I was chief resident. And I have a special love for education and training. And I transitioned over to aesthetics in 2017 from emergency medicine. So what I did was I looked at all the different trainings across the nation in aesthetics. And I said, I want to make sure I train my team at a very high level so that we're delivering the best patient care in San Diego, because we all know there aren't a ton of training programs out there. And you kind of have to mix and match the things that you receive from your industry reps when you have like peer-to-peer trainings or in-office trainings with the trainings that you've done at, say, AmSpa or the aesthetic show, or if you've taken like the aesthetic immersion courses or Empire medical training. There are so many out there. And you guys could even list here what types of training programs have you used in the past as we start this all off to get your staff up and ready for the most, innovative things that are happening in aesthetics, because you don't always have an expert on your team. We're blessed to have experts on our teams. My team consists of, as I said, those 13 injectors. We have 28 team members total. So we have a mix of admin, we have a mix of MAs, and we have a mix of, I'm the only physician, then we have RNs, PAs, and NPs that work on our team. And it's such a blessing to have this big mix because we can all learn from each other. And my most experienced injector, she actually has 21 years of experience, and she is an RN. And in California, if you know the rules of California, you may not if you're in another state, but it's a very, very strict operating system where a lot of our patients will come in and say, not a lot, but some, we do have these patients that come in and say, I don't want to see the RN, I want to see the doctor. And little do they know, well, I tell them immediately, the most advanced person on our team is actually an RN. And the beautiful part about it is she worked with me in the emergency department and she taught us so much of what we know. So as we dive in, we are going to have fun today. So we'll be keeping an eye on the chat. So please be engaged in this, ask questions as we go. Elise is going to be collecting those questions. I plan to talk for about 30 minutes and then take questions after that so that you guys can ask whatever you want to ask. And I'll just say this, I'm an expert in business in all aspects of business. In med spa marketing, I love to talk about operations. I love to talk about staff, pay rates and how you incentivize your staff. And then today we're going to be talking about the training piece. So I love sharing value with you guys so you guys can take that immediately back to your locations and then implement it and uplift what you're giving to your local patient areas. So feel free to ask questions. So first, why does staff training really matter? And how do we train our staff at HTB? These are the 2 things. Number 1, If you train your team at a high level, number one, the patient experience is going to be elevated, and your patients are going to have like a broad exposure to all of the services that you offer. Next, your staff is going to feel like they're highly valued. They're going to feel like they're constantly growing and learning within the walls of your business, and your culture is going to be uplifted. So, staff training is important for our teams, just not only for the patients, but also for our staff and our team culture, and to make everyone feel like they're constantly growing, because no one wants to feel stagnant. Now, we're going to go through how we train our staff at HTB. I also have an academy where we developed level 1, level 2, level 3, and expert level trainings, so that we can really take whomever we hire within the walls of our practice. If we hire someone that's perhaps a level 1 injector or a level 2, how do we get them to that next level? And how do we move them along so that they become an expert one day? So these are a few members of our team. We do team photo shoots. So this is a summer photo shoot. We do quarterly photo shoots, and we get together and we not only hold silly things like beach balls and wear silly glasses to engage our clients on social, but we also hold our products in our hands. And these really high performing teams, they're not really found out there. You have to build them, and you have to have this genuine love for your teams, because your teams will know if you truly care about their education. And what I can tell you is I have been told many times over, and so this is something I hope you can do. I've been told that lots of people don't train their teams at a high level. They don't lean into education wherever they have found it, wherever they can get it, even for free. And they don't focus on and maybe have an educational calendar in their break room. So we have team members that come over with lots of experience, and they'll say, I have never had this much education in my life, and I absolutely love it because I'm learning so much. And because sometimes your injectors, whoever's delivering care, they think they know everything, but they don't know what they don't know. And they don't know that there's so much more and so many other techniques that they could be adding to their toolkit when they're delivering patient care, whether it's in the consult or in their injection style or the way they, fire a laser. So we lean into this, and we lean into this from day one with hiring. We talk about how much education we have. And, that conversation, when you're at the very front end of bringing that team member on, is so important in letting them know you will receive education every 6 weeks. Every 6 weeks, we have a masterclass with a national or international superstar that we invite to a platform where we do a webinar, and we've varied that education throughout the year. We also make sure our main accounts are Allergan and Galderma, and we make sure those different pharmaceutical companies are bringing in different trainers on a quarterly basis for our team to learn from. And we make sure we're adding variety to what our team is learning. So like, for example, when Allergan launched platysmal band, the platysmal band application and the temple application, we made sure, especially with temples, that we had someone immediately in there, even if our team was already doing temples. So we tell people what they're going to expect from us, not only from the outside, but from the inside. And on the left here, holding the pink beach ball, is PA Katie Martin. She's Katie the Injector on Instagram if you want to follow her, but she's fabulous, and she's our VP of Clinical Operations, and she is our lead trainer. She's also a game trainer. But that doesn't mean that the other team members don't engage in training when we bring someone new on. So what does training do? It not only increases retention, because now your team members are going to go, how much training would I get at this other location down the street, even if they pay potentially a little bit more? Or should I stay here and uplift my skills, and when I get to that next level, I get a raise where I currently am? So helps with retention. Also helps with retention if you have a track for your team to become trainers. So if the new hire then comes in and they want to become a trainer, you paint that path of you could be a trainer one day, not only here at HTB, but for Alpha nationally. And then we can also show you how to be a trainer at on national stages at conferences if you so desire that. And not everyone does, because they might have some stage fright. Only 10 to 20 people really like being on a stage. So you really just have to learn where they want to be in that training matrix. And sometimes that's just a one-to-one training with the newest team members when they're shadowing, along the way. So retention, number one. Number two, sales confidence. They become more confident in our space, which in the end is retail medicine. When you're a cash-based business, we are retail medicine, still recommending everything the patient needs, but keeping in mind, like, they're paying cash and we never want to put our minds in their pocketbooks. We just want to recommend everything they need as if they are a millionaire. And it gives a better patient experience because now they're seeing the full breadth of everything that's being offered. And then thriving teams equal thriving businesses. And I'll show some case studies at the end of how different team members on my team moved up the ladder and how it resulted in higher revenue for my business and better business success. So our training philosophy, if you've ever seen me speak before, you know that I study with the 10X business community quite frequently. I've studied with them since 2021, and Natalie Dawson is one of the trainers she's actually the president of Cardone Ventures, which is an expert business course for business owners. And business owners basically can be taught here how at the highest level businesses are leading their teams across the nation. So she wrote a book. It's called Teamwork. I absolutely love it, and I highly recommend reading it because it helps you structure the way you onboard your employees. It even helps you structure how you hire your employees. So you could go back and watch one of these that I've done in the past about how we hire at Holden Timeless Beauty. But really, our core pillars are inspired by teamwork and then adapted to the aesthetics field. So our core pillars, number one, we have a structured onboarding. We have an onboarding plan. We make sure that people receive what they're going to be doing at least 2 weeks prior, so that then they're getting that information ahead of time and they know what to prepare for, so they mentally don't have too much anxiety about starting a new job. We then set forth a structured training plan over the first 30, 60, 90 days. And we have layered development plans based on where they are. And I'll show you an outline for this. And feel free to, take screenshots or take a picture with your camera so that you can kind of model your location after this. We make sure people have sales fluency. We have a sales trainer we bring in, and I'll tell you more about that in a little while. We are focused highly on safety and accountability, and then we celebrate growth to the max. We love to celebrate people and when they hit that next level, and I'll tell you what our core KPIs are in the future slides that you're going to see. So first, starting here with hiring and onboarding new injectors. So at HTB, we have a 30, 60, 90-day plan. The first and foremost thing we always focus on is culture. We have 8 core values, and when people are being hired at HTB, we make sure that they're a good fit with our core values, because that is the heartbeat of our business. And if they're not aligned with our core values, it's not a fit that we want to bring in. We don't want to bring in someone that's not aligned. So culture is number one. They present on core values before they even come in. And then we reinforce why those core values are so important within the walls of our business within that first 30 days. We use Repeat MD every single day. Every patient downloads Repeat MD when they walk through our door. They actually get $50 off just for downloading the Repeat MD app. It's a fun, nice incentive, but it gets them on there without a doubt. And now we can give them rewards every third visit. We have those strategically designed on the back end with the help of the Repeat MD team. And I know you guys do too, because the team is so fabulous, but we orient them on that and how they can use this as a tool, even as a tool for pushing new client referrals back to the business and showing them how easy it is to just text friends and encouraging them to help. We encourage our injectors to have their patients that love them, help them build their business. We then have our injectors, after they've gone through administrative shadowing, they go and shadow injectors. And then they start to see all of our core services, and they hear how we talk about them within the walls of our business. At the 60-day mark, if they aren't already at the expert level, which we do hire some experts in the beginning, which is a really nice touch, and you can accelerate it if you have hired an expert in the beginning, we will go in and observe consults. We'll give feedback. They will get hands-on practice. What we'll do is we'll carve out 4-hour periods, and we'll have them inject. We'll have them invite their friends and family in. We might give a 20 to 25% discount. Sometimes we'll let their friends and family do it for free. It just depends on how many samples we have for training. But we'll go in and then observe their skills, and we have a checklist to check off skills and services so that we know they know how to inject certain areas, temples, cheeks, chin, jawline. And they'll get that hands-on practice. If we recognize that they don't know a certain area, we'll then make a note of that, and we might have then a dedicated training just for that area, such as jawline or chin. And then we want to make sure they're fully ready to give to perform patient care. I'm not saying that they don't see patients in this period. They definitely dive in if they already know the basics of botulinum toxin type A injections, maybe the basics of lasers. They'll still be generating revenue, but we are making sure we're focusing on really making sure that they learn the business and all these pieces. At 90 days, they become very independent because they've been, kind of coddled by us. They've either been with me or been with Katie Martin, or they've been with other advanced injectors on our team. And now they're doing independent treatments. And then we're sitting with them and reviewing their treatments, reviewing new client consults, how high maybe their Botox units are that they're delivering on an average daily basis, because they might be just doing upper face and we see they're never recommending lower face, and we have to dive into, is that a training issue? Are they uncomfortable with injecting DAOs or doing a Nefertiti lift or doing the platysmal bands? So we really lean into that, and we become their mentors and we become their friends within the walls of the business. So the way that we've always structured things, and the way we structure things in our academy, is that we have a skill tier system. And typically it goes like this. And cannula can be moved down a little bit if you'd like it to be. But really, we start with toxin. Toxin is our number one. We know it's our gateway. Lips are next. Lips are the most popular treatment in our clinics. They are very complicated. But once you get lips right and toxin right, people will flood through your doors. We then go up to cheeks, and we're typically doing lateral cheeks and the arch of the zygoma. And then we move to mid-face. We kind of teach them a little bit about cannula. Tear troughs at level 3 are an advanced area. So we first want to make sure that someone's not a total cowboy and just pushing forward, not worried about a vascular occlusion, not worried about events, that they have that safety factor in mind, because that is a more complicated area and the highest risk area. And so they move to tear troughs, jawline, and temples. And then finally, at that expert level, they're doing combination therapy, and they may or may not be doing noses, liquid rhinoplasties, but I really reserve noses and then tear troughs. Those are my 2 areas that I am very careful about approving, because I know that they could cause devastating effects, devastating complications if they were injected wrong. So, and you don't need to have everyone do a nose. You could just have one of your team members do a nose. So they advance based on competency, mentorship, and whether or not they're ready. We feel that they're safe. They haven't had any big complications. They haven't had a lot of patient complaints. But we highly analyze things before we move them on. Next, we make sure everyone is trained in safety and our emergency protocols. This is our top priority. And I told you earlier that I was an emergency medicine physician before coming into aesthetic medicine. I retired from that, and now I'm fully aesthetics. But we have something called a code blanche, and we treat this just like a code in the ER when we call a code, because if you have a vascular occlusion, your team is going to freak out and they're not going to think clearly in that moment. So we spend about 6 months reviewing all the literature we had a vascular occlusion committee amongst our team at HTB, and we developed our own vascular occlusion protocol. We have emergency kits at each of our 4 locations. They're in a red emergency like kit that you'd have in the back of your car. But the kits are there. The hyaluronidase, we use Hylenex, is in our refrigerators. We keep, at our bigger sites, we have 20 vials. If you just have 1 vial, it's not enough. Make sure you're equipped with, I would say, at least 10 total, or know someone in the area, just so you have that available to you if you did have a vascular occlusion. We have aspirin. We prescribe NitroPaste because it's something that's easy to get quickly. But our kits have specific medications that we give our patients if we do have a vascular occlusion. And I've managed a few. I haven't had one myself yet, knock on wood, but if you inject enough, you will see them. And I'll say this, especially in the lips, they are easy to resolve, but they make you very afraid in the beginning. So you want to make sure your team is trained to respond to this. You want to have clear roles, you want to have team drills, and you want to have a communication protocol. So we have this all outlined. We have it on laminated sheets. So the manager or the MA can pull that kit with the laminated sheet and go off and read exactly what's supposed to be done as they're contacting us and taking videos of the tissue and the cap refill. And this really just keeps both our providers and our patients safe. I would also suggest when you're training your teams, make sure you have someone you can reach out to in your local community that if you did get into trouble and you couldn't reverse that occlusion, you could call them and send that patient to their clinic. That's having a plastic surgeon that you know in the community. It's having an expert that you know in the community. I'll tell you this, Lori Robertson, she's local and she will go in with an ultrasound. I just took an ultrasound certification course this past weekend on Saturday, but she'll go in and she has successfully reversed so many people's vascular occlusions when the team wasn't able to. So it's good to know who you can call when you're in that situation. In terms of your 30, 60, 90-day onboarding journey, this is just, for all roles, you want to make sure admin and injectors alike have company culture down, all of your products and services down, along with credentialing statements for each provider and each service that you offer. And you want to make sure you're listening to those phone calls. You want to also introduce them to Repeat MD in that 30 days and make sure every single patient that walks through the door is downloading the app, because that's going to result in so much more retention on the other side. They'll be able to search when they get back home. They'll be able to purchase in the app, and a lot of purchases are made at after 9 p.m., believe it or not. So it allows you to have a tool that patients can purchase on late night. At 60 days, you want to make sure that your admin has also seen some of that hands-on and they can communicate effectively what happens in the room. So they're communicating with confidence and their consults are just dialed in terms of your team members that are injecting. And then at 90 days, you're really mastering the role. You're reviewing your metrics, you're reviewing your KPIs for that particular provider. And then you're doing more private trainings according to what they need in terms of their skill level. Private clinical trainings then, these that happen after 90 days are led typically by our VP of clinical operations. So what you can do in your med spa is you can identify the person that you think is at the highest level, and you can either just expect them to carve out trainings if their capacity isn't full, or if their capacity is full during their injection hours, you can stipend them for a certain number of hours per month that they would give to one of your team members. So we do a stipend, and typically Katie does 4 to 8 hours a month of private trainings, and she interviews or talks to, as a friend, the particular injector that we want to focus on, and then she focuses on uplifting that skill that we don't see them, the product or service we don't see them delivering. She focuses on that for 4 hours with them, and then we look on the back end to see the success of that. And that can be a mix of just skill development, consult development. How do you sell retail skincare? What are you saying in the room to increase the number of toxin units you're delivering? And then live model demos, whether they're watching Katie inject or they're injecting themselves, which the latter is preferred. So you want to also think about if your team is not performing or particular people are not performing, what's going wrong in the room? Why don't you have a sales confident team? I would say the top thing to have in order to be successful is a team that is confident in sales. And that's one of the hardest things to do, is take someone that's been a provider in maybe a hospital setting, and they've come to us and sat in our chairs because insurance is already paying the bill and they need us for something, to reversing the role and now we're selling them something. You really just have to change the mindset of your teams to say, our patients are sitting in our chairs in the same sort of way. And you should never think about how much money they potentially might spend in terms of how much money would you spend. So if I was only comfortable spending $2,000 in a sitting, I might only recommend $2,000 worth of products and services. But if I recommend a package that over the next 6 months, this is how we're going to get you to your goals to hold time back, and that's going to be approximately $9,500. And you do this, and this. Like yesterday, we were talking about M-Face, CO2 laser, followed by Sculptra, then followed by Cheeks, and we'll put it all together in a package, and then we'll offer you 10% off that package. If you talk about it like it's no big deal, and you also tie in, oh, and by the way, we offer, you can buy either in the Repeat MD app, these packages. We also offer care credit. We offer cherry financing. So when you purchase at a high dollar amount, you actually can defer your APR and not pay this for a little while. So this is free money to you. And then you just pay it off before that APR period comes about. And honestly, patients love it because they have so many options. But you have to be comfortable saying all of those things and feel like you're delivering a service and never pressuring. And a lot of people will say, I love it. I love it because I never feel pressured. And I always have, I always say to my patients, I will never pressure you. I'm always going to recommend everything that you need for optimal results. And I have a formula, which is 5 steps to hold time back. And I'll let you know exactly what the formula is. But then you get to put together what you're comfortable doing. Not only what you're comfortable injecting or putting topically on your face, but what you're comfortable spending. And that's up to you. And you can add more and more over time. So we do have a professional sales trainer, his name is Moises, that comes in and works with the team, and he'll shadow a particular team member for about 4 hours, and then he'll give them feedback. And he'll give them feedback based on what they could do better or differently, and how they can add drama to the consult. And he's just so fantastic. So not only do we all talk together about how we deliver sales in a different way and deliver scripts, but he comes in and helps us. And the skills we typically cover: discovery questions. What are you asking your patients to discover what their true concern is? Are you giving solution-based recommendations in broad spectrum? Do you have cash-based closing techniques? And then this truly just helps providers confidently grow revenue. And now they're suddenly excited and they're focused on their revenue, and they're excited when they sell a big package. Okay, so next, tracking success. So what KPIs do we track? In our MedSpa, we track, number one, revenue per hour. So we take the clock in, clock out hours and the total revenue that that provider produces in a day, and we look at that. And typically, if your provider is doing $1,000 per hour or more, they're ready for their own dedicated MA. They're ready for an MA that is with them all the time, because if they had that, they could probably push up to 1,500 to 2,000 or more. We have some providers that make 100,000, 150,000. We even have someone in Alpha that makes 250,000 a month. So as we see that that's possible, we show our team members comparisons of what other people are doing, and they suddenly want to compete to get up there. So people love to compete to have the highest revenue per hour. We also look at our service mix. So we look at what the margins are in each service area. We look at how much we're doing. We compare our service mix compared to last year, and has it gone up or is it going down? And we focus on that. And we like to really review each cycle and identify these gaps in potentially, say, if laser sales are going down, well, what happened? Do we have less ads that are going out that promote laser to come through? Or is our team just not talking about the fact that we have laser hair removal? So someone's coming in for Botox and filler, but they don't know we do laser hair removal. So that's making sure you have a very great welcome with a tour of your facility where they know every little thing that you do. And you can even put the list of services that you offer on the backs of the patient doors so that when the doors shut, they can sit there and stare at all the services that you offer at your facility. And then you want this training just to be ongoing throughout the year. And even the people that have been injecting for 8 to 10 years, make sure you're focusing on training them as well, because they might have forgotten things, or they might just want to see something a different way. So it can be very valuable to focus on them as well. So case study number 1, Chelsea, she came over. So Chelsea was an injector that I hired. She had 5 years of experience. She was confident in sales. I can say she didn't join with necessarily limited sales experience. I should have changed that wording, but she wasn't as confident as she could be. And she was just she's very sweet. She's loving. And she didn't always want to recommend everything potentially. So she learned to recommend everything, and she grew into a top performing provider. She's had ongoing mentorship. We initially did this 90-day plan. She did an internship, and she had come from Laserway, and at Laserway, they only do on-label treatments. So she was so excited to learn all the off-label areas, not only for toxin, but for filler, and then all the other services that we offered. And we saw her revenue double. She's now on track to become an alpha partner. We have a partnership path with inside our med spa, and she has an extremely high client retention. So we have focused on sales training. We've tracked her KPIs, and we actually send out a weekly email to our team showing them their monthly goal to revenue, their monthly rebooking rate, and their monthly retail sales revenue to date. So, and then the managers at each site, we look at these KPIs, and they send me CC'd on the email, and I can see where she's tracking. And I think she hit 123% above goal this month. Really incredible. And she has like a 85% rebooking rate. So if you can focus on your team's rebooking rates, I'll tell you, their capacities will start to be filled. If you can do a 2-week follow-up for toxin to see if that patient's toxin kicked in appropriately and create their perfect facial map, they'll buy something in that second visit, and it's not just a waste of time, and they learn to trust you at a deeper level. So you can add things where you're seeing people even back a month later after filler and seeing if you can optimize their results, and they'll buy the next thing, and they'll want to talk to you about, okay, what's next in my journey? So that's what we've done with Chelsea. Now, Katie started as an emergency PA. She went and trained in plastic surgery, worked for a local plastic surgeon, and she came over to HTB as a level 3 injector. She was quickly promoted to expert. She trained with our injector that has 21 years of experience. She became a gain trainer. She studied across the nation, started training on stages. She's been first assist to so many people, Sheena Bay, Gideon Plock, and she's currently at a training with those individuals for MERS right now, for hyperdilute radius in the neck, which is going to be very exciting. So she's going to bring that back to us next week. But she really leveraged sales coaching. She did a lot of sales training in the 10X community. They have a sales platform that you can put your team on, and they can study sales on a daily basis. There are like 11,000 videos on sales that Grant Cardone does. He's one of my mentors. And she optimized her services, and she's the one that is now our VP of clinical operations. She typically hits the highest revenue for the day. Yesterday I beat her, so I was very excited. But she became our clinic leader. She's VP of Clinical Operations, and she helps train all of our new team members. And she is an Alpha partner. So absolutely love her. She's on our clinical excellence team nationally for Alpha. So if you have certain training challenges with your team, so I'll just say these are the ways, these are things you can overcome. So if you have high turnover, burnout, or uneven skill levels, you just need to develop a plan. Level 1, level 2, level 3, expert, and then how are you going to regularly bring in trainings from your reps? Your reps want to be there. It's free training. You should lean into it 100%, and you should make sure you have one level 3 or expert on your team, or be able to hire someone from the community to come in and train your team to level up each and every 6 months or so. So we have these clear onboarding paths, as I said, safety protocols, and our mentorship culture, and then regular coaching and growth opportunities within our team, and just a constant culture of positivity and uplifting everyone. So final thoughts, I would say, what you should be doing every single day is thinking about, how can I infuse positivity into this team to lift them up, to build them up to a higher level, just like we would build up our family. It's our work family. Build them so that they then can thrive within your organization. And training truly is the foundation of retention. Training in every way, in scripting, in consults, in how they deliver care, in the follow-up, in what that long-term plan development with the patient looks like. And make sure every role has a clear growth path, because no one wants to be stagnant. No one wants to be hired and not see where they could go next. They want to see that there is a possibility to grow. And just remember this: teams do not deliver treatments, they deliver and drive the brand and deliver the culture of the brand to the patient. So if your culture is a culture of excellence, a culture of experience, a culture of innovation, these are just some of our core values, the patients know that, they understand that, and they don't want to go anywhere else, because they realize how much you care about your teams, how of a high level skill your team members have, and then they just want to choose you every time, and your retention will be off the charts. So leave you with this final quote. I love encouraging people to dream bigger and get to that next level, not only in their practices, but their own personal lives. And Walt Disney said it best: it's kind of fun to do the impossible. So with that, I would love to answer questions. I know Elise is back on stage. What I'll say first, though, is please follow me on Instagram. My personal Instagram, where you're going to be talking directly to me, is dr.amanda.holden. Okay. I not only give you mindset tips, give you mentoring tips, but also connect you with people that are on my podcast. I have a podcast called Holding Time Back on Apple and Spotify. I'm partnered with Dr. Jean Carruthers, Julie Horn, Lori Robertson, people that are greats in the industry, and they tell their stories to you about how they deliver the best care. So this is a way for you to train yourself at a high level. You can find me on LinkedIn as well. I'm most active on my Instagram, and then this is my email here. And then my med spa over here is Holden Timeless Beauty Med Spa, so you can see how we advertise things and what we're doing. We try to follow the latest trends. So feel free to take some of the things that we're doing and add them to how you're advertising. All right, Elise, I'm ready for questions.
Okay, yeah. If anybody has any questions, go ahead and put them in the Q&A or in the normal chat, and we'll answer them from there. First question that we have is, spending $30 on training an injector, how do you ensure that they stay once they are trained? Do you have a contract with your injectors?
So we do not have contracts with our injectors because there are ways that you can create contracts to try to get them to stay, but they'll always leave if they truly want to leave. We personally don't do contracts. So in the beginning, I'll say this because everyone's probably at different stages. In the beginning, I developed my own training program, and I would bring on brand new nurses, brand new PAs, brand new nurse practitioners, brand new doctors, and I would train them in the level 1 training program that we have. So they'd learn tox, filler, tox, lips, cheeks, really. And it takes, I don't know, regular practice. I mean, you can learn in a couple weeks toxin, but regular practice to become really good after you've seen all the before and afters of all kinds of different faces, it takes about 6 months. I would say filler has more of a year before they're pretty good, because they're still not that good in the first 6 months. So it takes a little while for them to get there. So we give them all of this training. We have a partnership track. We have so many things internally that we do for retention with education, that is our piece of retention. That's how we ensure that they stay. Even then, there are always going to be people that leave. So you want to make sure that you have a backup plan, that you have people there. I mean, really look at how much it costs to train that provider as a number. Say it's $5,000 to get that provider up and going. Then they're going to be starting to generate revenue for your practice, and that revenue is going to keep going up. But make sure you're thinking, am I ready to train that first injector, bring them on, and do I have a backup if this one leaves? So always just be thinking about that. I'll tell you, so that's how we did in the beginning. Now we recruit people and we hire people that have anywhere from 3 to 10. I just hired someone with 20 years of experience, and they want to come to a med spa home that gives them guidance, gives them patience in their chair, gives them mentorship, gives them continuous learning and education, and they have a work culture. So it's about building all those pieces within the walls of your business, and they will want to stay if you've built an incredible team and you're paying them enough. You're compensating them with industry standards. I'll say one more thing here. Some people do a contract. They'll say, I'm going to bring you on, but now I'm going to train you for 90 days. This is the equivalent as I pay you of the X amount of money. And if you leave before the year mark or the 2-year mark is up, you'll owe a percentage of this dollar value back to me as your educational return. So some people do set those contracts up with legal, and they retain people in that sense. So that's an option for you to do as well.
Awesome. Hopefully that answers your question. Neil asked about your turnover rate at HTB.
So our turnover rate has really been more dependent on if we change bonus plans. It's very interesting. So injectors want to come on and they want stability. In the sales environment, sometimes people change bonus plans on an annual basis. When I started in 2017, I developed a bonus plan based on interviewing a lot of other people in the industry, and I made up my own that I felt comfortable with. And as I moved forward, I really didn't change my structure much because the team wanted this stability. And then we had the idea, okay, let's change this bonus plan for certain metrics to ensure that we fill capacity and people don't always take off time, because I had a lot of per diem part-time injectors. And when we changed our bonus plan, we lost 3 people, which was very interesting. So, but before that, the people that we lost, and I'm talking injectors, were people I ended up letting go because they weren't a fit for our company and they weren't aligning with our core values and culture. Since that time, we've had a retention rate. We haven't had a high turnover rate. But the place where you will have a high turnover rate, most likely, is your front desk. And the hardest part is the lowest paid people on your team. They don't always want to stay forever. They have other dreams and goals. And when you're someone that motivates people to dream bigger, they're constantly going, oh, Dr. Holden's saying dream bigger. What should I do so that I can make a higher level of income and go do the next thing? So in terms of turnover rate for a front desk, ours can tend to be pretty high, and I'm okay with it, because we see people move on to bigger, better roles before we have a bigger, better spot open for them within our business, because they're accelerating at such a fast rate, maybe, 6 months down the line or 24 months down the line. And then they're moving into this next bigger role because now they've dreamed bigger. We actually do 1, 3, and 5 year goal conversations with our team, and we talk to them about setting goals in their life. And when they do these goal conversations and write down the goals, they see the possibilities. So they end up going. So what I'd say is turnover. Try to stick with a relatively stable comp plan, especially for people that you've hired, because care providers, nurses, PAs, nurse practitioners, docs, we're not used to having our comp plan changed a lot, like a traditional sales team out in the world of like grinding and stock market or other fields like that. So hopefully that answered your question.
Awesome. Thank you, Dr. Holden. And then we have one more question that came through. Says, what is the best way to effectively train on company culture and values as a solo provider with 2 new employees?
So the best way, I would say, to effectively train on, I'll say number one, culture, is hire with the culture, your culture outlined already in your mission, vision, and core values. You can find, if you haven't created one yourself and you've relied on, like, say, an HR offsite person to create these, read Natalie Dawson's book Teamwork, and then start hiring based on your culture. And then when they come in, you first go through an outline of what the company culture means to you, because you're the solo biz. If you're the solopreneur, you're saying you're a solo provider with 2 new employees. I guess clarifying question: are these 2 new employees injectors or admin? But I'll answer it regardless. If the 2 new employees are other injectors, you want to outline what the heartbeat of the business is, how you deliver care. You want to outline where you see your business going in the future. So you have to cast a vision in order for people to get excited about working for you. And then you have to tell them, okay, this is the heartbeat of the business. So one of our core values is excellence, then experience, then innovation. And you explain what that means to you, to each of these providers, and you keep bringing those words into the daily training as they're training at the front or they're training in the room to do consults. You keep bringing up those words so they almost ring, ring around the office every single day. And that's how you train them in your core values and your culture. And then if you ever see them doing something in that probationary period of 30 to 60, 90 days that doesn't align with the core values, you have a very transparent conversation with them and say, hey, this didn't align with our core value of professionalism or teamwork, and we want to make sure we're all working together. Teamwork is so important to this organization, so that we all uplift each other. So it's hard to manage people, I'll tell you that. It's difficult to have lots of employees because everyone has different personalities, and one of the biggest things you can do is understand your people and understand how they like to be managed. So we do something called the R3 assessment, and it shows whether you're an influencer, a driver, an analyzer, or a stabilizer. It kind of gives a personality assessment. If you've ever done the colors assessment before with like red, green, blue, yellow, you'll know where that person is, and then there'll be a certain management style for that person. So the more you can get to know people, the better you'll be as a leader, not only in the onboarding phase, but in the continuous mentorship phase and then the growth phase of your employee.
Love that. Awesome. Okay, I don't think we have any other questions. I'll give everyone a minute or 2 extra. If you can think of anything else while we do that, I'll walk through. So we had somebody earlier ask about the recording. So the recordings are found in your admin panel under past masterclasses. So if you click on that link, it'll take you to a page with Dr. Holden, this masterclass, and also all of Dr. Holden's past masterclasses that she's done along with our other experts. If you need help finding that page, reach out to me, let me know, and I'm happy to show you where to access it. Our upcoming master classes. So next week we have Chris Balby doing Repeat MD 101. This is a recurring master class, but he just goes through the Repeat MD basics and how to make sure that you are getting the most out of your app. On the 14th, Lisa Krause is back and she's going over accountability, so team accountability and managing your team. And then on the 27th, Terry Ross is going through 5 sales KPIs that every aesthetic practice should use to scale revenue. And so, yeah, those are upcoming master classes. And then lastly, we are in the middle of our Mother's Day promotion right now. If you haven't opted in, go ahead and click that QR code if you're interested. Our team takes care of everything for you. So we'll make sure that you just tell us what promo you want to offer and we'll make sure that we have it set up. So I think those are all of my announcements. Dr. Holden, we did have one more question come through if you've got a second.
Do. Yes, I'll answer
Okay,
that one. I
cool.
see it. How do you find a sales trainer? You could DM me. I could connect you with some individuals. B, you can use ChatGPT and ask who are the top sales trainers in medical aesthetics that offer individual one-to-one training for your team, and will come out and sit in the room and train you in that way. I use the 10x community, so there's 10x sales. If you go to the 10x website, just the number 10x, you'll find a 10x sales training that you can take. It's a 2-day course and you can bring that training back to your team. But if you want someone in office that comes to you, you can hire a consultant that comes in, and we use an individual named Moises, so I could connect you with him, or any other individuals. I think Terry Ross actually does some sales training. She's amazing. She'll come out to your office too. So there are lots of people out there. So just DM me. I'll help you connect you with groups, and I'm happy to help.
Awesome.
Okay.
Okay, great.
Happy Friday.
Dr. Holden, thank you so much. This is amazing. You are awesome as always, and we look forward to having you on next quarter.
Thank you. You're welcome,
Okay,
guys. Have
bye
a good day.
everyone. Hope you have a good weekend.
Okay, bye.